I will be demonstrating the application of dental dam for a anterior incisor when the situation is for an endodontic treatment required, or a cervical class dental dam on a single tooth, number 2-1 only today. Okay, so we want to ensure the client is understanding what is happening, so we're going to perform dialogue by explaining the procedure to the client and informing them that we are going to be placing dental dam on a front tooth, and have they had it before, and if they have, that's great. You can do a little friendly reminder of what's involved and receive client consent. If they have not had it before, you most definitely want to explain the procedure and why you use the dental dam, which would involve an explanation of that it keeps the area dry, it helps the little smoother with less complications of having to worry about water, and it prevents debris from falling down their throat, which is always a great asset as well. You also want to ensure that their comfort level is high, so you want to also inform them that they can breathe through their nose and still swallow as normally throughout the procedure. If they have any trouble at all throughout the procedure, please tell them that to raise their hand or give you some help their comfort level. Okay, again, receive client consent prior to application of the dental dam. Once you receive client consent, please ensure that you are maintaining your principles of ergonomics, have yourself positioned, your client and equipment in the proper positions. Also, practice your instrumentation techniques, ensuring that you're using a fulcrum when applicable at all times, and that your mirror skills with using indirect vision and retraction are also being used. Okay, so quickly examine the treatment area. We know that is for the 2-1, but we want to see if that tooth is rotated or any complications that could arise throughout your application you want to be aware of first. Okay, looks fine, nice and straight, shouldn't be a problem. If you feel you want to floss that area, please go ahead and do so. If it looks like there's maybe a bridge or a crown there, but in this case it's a single tooth, so no complications, and I confirm that by flossing. When you're punching this dental dam for a single tooth, okay, you would just simply do that. Use the tooth hole size for this type of clamp. The clamp that we're going to be using looks a little bit different than what you've been used to. It's the 212 clamp, okay, and there are others out there on the market, but it's twisting on me a little bit. Okay, so it looks something like that. So you're going to actually place the dam on first. The 212 clamp has a long side and a short side. The long side will go towards the facial. The short side goes on the lingual aspect. Okay, these jaws, I'm just going to indicate the jaws to you. Again, a little bit different than the previous clamps. Are serrated to help with the retention of the clamp on a single tooth. Okay, I have already chosen this clamp. I knew ahead of time that's the one I'm going to use because it's for a tooth that needs a endodontic treatment. Okay, and I have attached safety floss onto the clamp. Okay, I am prepared now, so I want to check the anesthesia for effectiveness. Okay, I'm going to check the 2-1 area again by retracting the lip just with my fingers and using a fulcrum with my Explorer around the 2-1, and it seems fine. You can ask the client, did you feel anything with that? Does it feel comfortable? And yes, it does. So the anesthesia is effective in your dental dam. Okay. As previously mentioned, I punched the single hole for the tooth size. So even though the clamp is going on this tooth, because we're placing the dental dam first, it only needs to be a size 2 hole to go on the 2-1. Okay, so dental dam is placed first in this situation and placed over top of your tooth. like so. Okay. What you want to ensure is that you're retracting the dental dam on both facial and lingual aspect as much as possible. Okay. Okay, you're just going to let go of that for now. You're going to get your clamp ready. You're going to orientate yourself to this clamp again. Okay. Long side, short side. Okay. Long side, you're going to put your beaks right in those little grooves of the clamp. Can you see that right here? And right here, the little grooves. That represents where the holes would be on all other clamps other than this one. And I'm going to wrap this safety floss to ensure stability. Okay, so I have that in my dominant hand, the clamp with my forceps. Okay, I go back with my non-dominant hand, try to retract the dam, facial and lingual, as much as possible, and stretch open. Gonna place it on the facial aspect where you can see directly first. Okay. Try to avoid dam getting caught under there. I felt myself go over the height of contour, which is great. Slowly release. You're going to have to use direct vision for the lingual because you cannot get your mirror in your other hand because it's busy. Okay. Okay, what I checked there is to see if the dental dam is caught under the jaw, and it was, so I'm just replacing it. And I'm releasing it. Okay, going to bring that floss over to the other side. Getting down my forceps, getting my mirror. It looks good. Okay, and now you basically put your frame on. Okay, I'm securing the floss to the frame. Okay, you don't have any of the steps. There's no ligature, there's no inversion process. So you simply go into the stretching of the dental dam over all the prongs on your frame, and you are complete with the application. Okay, the operator will come in and do the procedure, whether it be an endodontic treatment or a class 5 filling. And at the conclusion of that, you will make sure to rinse with the high volume evacuator in that area to ensure all the debris is gone. Rinse holding the air water syringe in your dominant hand, HVE in your non-dominant hand. Make your little trough. Give the water somewhere to go. Good. And then you may go into the removal. I will be using my mirror for indirect vision. Okay. So the forceps, I'll line it up on the facial and then use my mirror for indirect vision on the lingual. There we go. Once you're in there, it just squeeze the forceps, opening up the clamp. Let go of the clamp. Forceps, let it hang on your frame. Remove this as units. So for removal, again, there's no ligature, there's no septa to cut. It's just simply removing your clamp, and that is it. Again, you want to ensure client comfort. Give a full mouth rinse with your air water syringe and saliva ejector. Okay, freshening up the client's mouth, making them feel like they're back to normal. And you would provide a tissue to the client if there was any splashing, which there a little bit was, and you may close and relax your mouth. While the client is just relaxing, you're going to remove the dental dam off the frame and ensure that there hasn't been any tears in your dental dam by lying it again on a flat surface. and the hole looks intact. So we'll also ensure that there's no missing pieces by checking the oral cavity. And it looks good. There's no dental dam pieces in there. Okay. If there was, you could remove them with a piece of floss, a cotton pliers, or Explorer. How are you feeling? Feeling okay? That's fantastic. And that concludes the demonstration of the application and removal of dental dam for a single anterior tooth.